Well, good afternoon, everyone, and welcome to today's webinar, where we'll be exploring trends, key findings from the 2020 Pulse Trends Report. My name is Thea Guerin. I'm a senior director here at the Financial Health Network. I lead the U.S. Financial Health Pulse Research Initiative, and I'll be your host for today's webinar. I'll be joined by my colleague, Andrew Dunn, who led the data analysis for the Trends Report, who will present key findings from the report in just a few minutes. So with that, let's go ahead and dive in. And I'd like to share that at the Financial Health Network, we abide by and we expect our webinar attendees to abide by the spirit and the letter of antitrust law. So this is more or less how the next hour or so that we have together will go. I'll begin with some brief welcome introductions and opening remarks. I'll then share a few thoughts on the methodology, provide you with a brief overview of the financial health measurement methodology and the methodology we use to calculate key findings for the 2020 Trends Report. I'll then turn it over to Andrew to walk us through the key findings from the 2020 Trends Report in more depth. We'll conclude with 10 or 15 minutes or so of audience Q&A. I do want to encourage you all, though, to submit any questions you have throughout the presentation using the chat function on the right side of your screen. Feel free to submit those questions as they occur to you. We'll then take them after we present the key findings. And we'll wrap up with covering a few ways that all of you can engage with Pulse data further. Right from the outset, I would like to thank our key funders and partners on the U.S. Financial Health Pulse, without whom this initiative really would not be possible. I'd like to thank Flourish, MetLife Foundation, and AARP for their support of the U.S. Financial Health Pulse over the last 3 years. I'd also like to thank our partners at the University of Southern California's Dornsife Center for Economic and Social Research, as well as our partners at Plaid for their ongoing support and participation in this initiative. With that, let me then preview the key findings from the 2020 Trends Report, which again, Andrew will cover in more depth in just a moment. So at the very highest level of the key findings, at that national or that aggregate level, we actually found this year that overall financial health in America actually improved since last year. And I'll share that when we first found this key finding, it surprised us. It may surprise some of you listening to this webinar. How could financial health improve over the past year in the midst of this ongoing unprecedented pandemic that has caused millions of jobs to be lost over the last couple of months? How on earth could financial health improve against that backdrop? But as we dug deeper, we began to see that the improvements that we observed at the national level appeared to be driven by a confluence of one-time interventions and events related to the pandemic. So things like the stimulus payments that were distributed earlier this year, the additional $600 in federal unemployment insurance, the loan forbearance and forgiveness that many banks and other financial institutions offered over the summer. All of these interventions, policies, and events serve to help people really stay afloat over the summer. But for that reason, we also hypothesize that some of these improvements, again, that we see at that aggregate or national level, may prove temporary because they appear to be so closely linked and really driven by this confluence of these one-time interventions and events. Digging deeper into the data, we also found that despite some of these positive improvements on the national level, that the majority of people in America are not financially healthy, and that many are actually experiencing extreme financial hardship amidst the ongoing pandemic. As we continued to disaggregate the data, continued to dig deeper, we also found that certain groups of Americans, specifically Black Americans, people with lower incomes, as well as women, are really bearing the brunt of the ongoing COVID-19 crisis. And largely as a result of these trends and these findings, we observed that financial health disparities have actually widened across key areas, specifically race and income, over the past year, while they have persisted across gender over the past year. So again, in just a moment, Andrew will dive deep into each of these 4 key findings. We'll leave plenty of time for audience engagement, questions, and answers. Before I turn the presentation over to Andrew, though, I want to share just a little bit about the research methodology that we use to derive those key findings on the previous slide. Now in its 3rd year, the US Financial Health Pulse, excuse me for the delay in these slides, we have a slight lag here. Now in its 3rd year, the US Financial Health Pulse is an ongoing research initiative that draws upon a combination of survey and transactional data to provide an ongoing snapshot of the financial lives of people in America and how those financial lives are changing over time. So to collect survey data, we partner with the University of Southern California. We field ongoing annual surveys to their Understanding America panel, a nationally representative online consumer panel that we've again been using to collect survey data for the last 3 years. Individuals are invited to join USC's consumer panel through an address-based sampling approach. And individuals who lack internet connectivity are offered Wi-Fi enabled tablets to ensure that the panel is as inclusive and as representative as possible of the entire US population. This year's 2020 Trends Report largely draws upon survey data from a survey fielded from July 27th to August 9th of this year. And you'll notice that those dates are interesting for a few reasons. One is that these dates represent really the expiration of those additional $600 in additional federal unemployment insurance that I mentioned a few moments ago. They also represent a few months after stimulus payments were delivered, suggesting that in many respects, the data that we collected may actually represent a financial health high watermark, and we'll be doing more analysis to test that hypothesis over the next couple of months. Again, for this year's survey, individuals could elect to respond to the survey in either English or Spanish, with the vast majority of respondents choosing to respond to the survey in English. A total of approximately 6,400 individuals ended up responding to this year's survey, and this data set, this overall sample, was weighted to be nationally representative. I should also point out here that the surveys, the ongoing annual pulse surveys, employ a cross-sectional and a longitudinal design. So about 4,500 individuals within that 6,400 person sample have actually responded to all 3 years worth of surveys, providing us with a decently sized longitudinal sample that allows us to track how financial health of individual households changes over time, alongside insights about how the financial health of the overall country changes over time. The transactional data that we use in the 2020 Trends Report that we'll share with you in just a few moments today is also collected from members of USC's nationally representative Understanding America Study, or UAS panel. And that data aggregation platform, that data collection platform, uses Plaid's API on the back end to allow individuals to link their financial accounts across multiple institutions, multiple companies, multiple financial service providers to this centralized platform, and giving us as researchers the ability to view and to analyze all of the inflows, outflows, and balances across those multiple accounts that form the basis of our transactional data sample that we use for analysis. So earlier this year, approximately 9,000 members of USC's UAS panel were invited to participate in this portion of the study. a little more than 800 individuals eventually consented to participate in this portion of the study and to link at least one financial account to this platform. I should also mention that individuals, that the study participants were offered a small monetary incentive for their participation. So $10 for an initially linking a financial account to the platform, as well as $1 for every month that account remained active to guard against attrition. And of those 872 individuals who linked an account, by far the most commonly linked accounts were checking accounts, savings accounts, as well as credit cards. And so these figures really form the basis of that transactional data sample that we use for ongoing analysis that we'll share highlights from with you all today. Before I move on, I do want to offer up one way to think about this data, and it's to the extent to which it's nationally representative. So any insights that we share that are based on the survey data sample, that are based on individual survey data responses, are indeed nationally representative. They can be construed as representative of sentiments across the entire country. The transactional data insights, though, are not fully nationally representative. So the demographic characteristics of those individuals, those 872 individuals, largely align with the demographic composition of individuals who bank online, but there are some skews along some key demographics, race and ethnicity, gender, age, income, and education. So I would encourage you to think about any of the insights that we present based on the transactional data set as simply being illustrative of trends at the national level and complementary to some of the survey data insights that we share with all of you. A few final notes on methodology. Throughout the US Financial Health Pulse, throughout the rest of this webinar, when we talk about financial health, we use the Financial Health Network's core definition of financial health. That financial health comes about when one's daily financial systems help them build resilience and pursue opportunities over time. And we use the 8 key indicators of financial health to measure financial health. So an individual, or in this case, a survey respondent, is financially healthy if they spend less than their income, they pay their bills on time, they have sufficient liquid savings, sufficient long-term savings, manageable debt, a prime credit score, appropriate insurance, and they're able to plan ahead financially. We also use the basic FinHealth score framework as the basis, again, for the methodology in the 2020 Trends Report. So for every individual who responds to survey questions that align with these 8 key indicators of financial health, we can calculate one aggregate FinHealth score on a scale from 0 to 100 that we can then use to segment survey respondents into one of 3 financial health tiers. Individuals who receive a financial health score between 0 and 39 on the low end of the spectrum can be considered financially vulnerable. These are individuals who may be struggling with most, if not all, aspects of their financial lives. Individuals who score in the middle between 40 and 79. These are individuals who are financially coping. They may be struggling with some, but not necessarily all aspects of their financial lives. And individuals who score between 80 and 100, again, based on those 8 indicator multiple choice questions, these individuals can be considered financially healthy. So they're spending, saving, borrowing, and planning in ways that allow them to be resilient and to pursue opportunities over time. So with that, let me turn it over to Andrew to walk you through the key findings from the 2020 Trends Report. And I want to again take this opportunity to encourage you all to submit any questions as they come to you via the chat, the question and answer function on the right side of your Zoom screens. We look forward to answering some of those questions right after Andrew finishes his portion of the presentation. Andrew, take it away.
Cool, thank you, Thea. Yeah, so as Thea mentioned, I'm going to start walking through our findings, our top 4 findings that we found in the U.S. Financial Health Pulse. And as a reminder, my name is Andrew Dunn. I'm a manager on the program team. I've been working on the Pulse since its inception, so it's really exciting to be able to show our data from both our survey and transactional collection in a way that's really helped us learn about the financial health of the United States. So as Thea highlighted at the very beginning of this presentation, contrary to what we had initially expected, we found that there was an improvement in overall financial health of individuals since our last survey in 2019. On the next slide, you'll see that the comparison of financial health tiers from 2018 through 2020. And on this slide, we're looking at the tiers based on those individual financial health scores, which Thea just explained. So again, from the highest to the lowest scores, we have the financially healthy tier, the coping tier, and the financially vulnerable tier. So from 2019, the percentage of financially healthy individuals increased by 4 percentage points, while the percentage of coping individuals declined by the same amount. And there was no change in the percentage of financially vulnerable individuals. That stayed constant since 2018. When we look one level deeper at the financial health indicators, we can explore what contributes to this finding and the overall improvement of financial health. And we observe that all but one indicator of financial health improved since 2019. The largest improvements were in the indicators of short-term and long-term savings, which, again, as Thea explained, considering that we're surveying people right after they'd received stimulus payments and as unemployment insurance was still rolling in, that could explain some of these findings. On the other hand, the confidence in insurance indicator declined considerably over the past year. Now, some of this decline might have something to do with a slight methodology tweak to the survey question that we asked in 2020, but we still think that COVID-19 related concerns largely drove this decline in confidence in insurance. And we mentioned that we have transactional data. So we can start digging into these indicators by looking at our transactional data, which was collected throughout the COVID-19 pandemic and for most of the past year. This provides a more detailed look at the inflows and outflows of individuals from their checking, savings, and liquid accounts. So in the purple line on this graph, you'll see the inflows summed over the past month for individuals in our sample, and the light blue line is outflows. So when we track these inflows and outflows in liquid accounts, we see that inflows generally exceeded outflows in the study period. The purple line is generally higher than the blue line, but the two move together, which implies that people generally spend more when they have more income, although it could be the opposite. People might do more to increase their income when they have high expenses. But we can actually unpack this finding a little bit further into what contributes to these spikes in inflows in March and May on the next slide. And we see that this is explained by two temporary boosts to inflows. So the first aligns with receipt of tax returns for early filers in March. So that blue line shows the graph of demonstrating the receipt of a tax return, while the purple line shows when stimulus checks began to be dispersed in mid-April. So again, the line would be pretty much flat, which is that dark blue line, were it not for the receipt of tax returns and stimulus checks. And although neither of these boosts were long-lived, they both helped inflows stay above outflows for quite some time through the end of July. Looking at the spending side of things and moving to credit cards, we see that people dramatically cut their spending on credit cards as the pandemic took hold in the United States in March and April of this past year. So on credit cards, we see that spending reduced by about 33% or $200 between mid-March and late April. Spending did pick up later in June and July, but it still didn't return to the same levels as March. And actually, when we look at more recent data than what's on this graph, we see that the spending decrease after July, which is that spike and decline at the right side of the graph didn't sustain. So people were, kind of dramatically, to the tune of 33%, cutting back on expenses as they experienced lockdowns through the pandemic, but also a kind of change in financial behavior throughout the pandemic. And we can actually look one level deeper at spending across different spending categories. So as Thea mentioned, we receive transactional data, or transactional data shared via Plaid, and we have expense categorization, so we can look at how people spent in specific categories. So we see that spending changed to reflect the pandemic and lockdowns in many states during our research time. So looking at these specific categories, we see that travel spending sharply declined in March and April, although increased a little later on in June. While digital spending consistently rose as people were spending more and more time in lockdowns. Spending on eating out declined sharply and has not really returned, although gradually crept back up. And spending on recreation, again, dramatically decreased and has stayed fairly low, reflecting a change in people's financial activity during the pandemic. Moving on to our second finding, despite this improvement in financial health, we still find that the majority of individuals are still not financially healthy. And there's a lot that we can unpack there, particularly in light of the COVID-19 pandemic. So again, 2/3 of individuals in America are either financially vulnerable at 17% of the US population, or financially coping at 50% of the US population. This aligns with millions of individuals in the United States. And looking at our longitudinal data, which is following the same individuals over the past several years, while there were improvements and movement between these financial health tiers between 2019 and 2020, some people did experience decreases in financial health and moved to a lower tier. 6% moved from being financially healthy to financially coping, and another 5% moved from financially coping to financially vulnerable. So even though there was a net increase at the highest aggregate level, there's a lot of movement below the surface, and a lot of people experienced declines in their financial health. And these changes and reductions in financial health are even more significant because we know that lower financial health is correlated with challenges in other areas of people's lives. So we asked individuals on our most recent survey if they were worried about hardship in a variety of aspects of their lives. And among those who were financially coping and vulnerable, 1 in 5, or 22%, said that they were worried their food would run out over the past 3 months. 1 in 4 said they were worried about not being able to afford their rent or mortgage. About 29% said that they spent down their savings to cope with the effects of the pandemic, and 41% had carried a balance on their credit cards to make ends meet. So these reductions in financial health and the overall relationship between financial health and other areas of people's financial lives demonstrates the hardship that those who are struggling with financial health are experiencing during the COVID-19 pandemic in particular. But looking at some other survey data, we do see that these one-time policies appear to be impactful in protecting people from further hardship and further declines in financial health. So we looked at the assistance provided to individuals and how that helped recipients from greater financial challenges across a couple of dimensions. And we saw that people who received stimulus payments were 6 percentage points less likely to say they were worried that their food would run out after controlling for other household factors like income and number of children under the age of 18, relative to those who had not received stimulus payments. Similarly, those who received unemployment insurance benefits were 12 percentage points less likely to say they are worried about not being able to afford rent or mortgage payments, compared to those who had applied for unemployment insurance but not received it. And so while this is observational data, so we can't definitively prove that unemployment insurance led to a reduction people's ability to afford expenses. It does make intuitive expense, and we control for other characteristics that could be explaining this, like income. Our final finding here was that people who received debt relief were 15 percentage points less likely to say that they did not get health care because they couldn't afford it, compared to these individuals who had applied but not received debt relief. So this gives us some pretty good indications that these one-time policies and government programs had protected recipients from further financial hardship. But moving ahead to our next finding, despite what I just mentioned, these government programs, we did find that the COVID-19 pandemic was having disproportionate impacts across people in the United States. So Black Americans, people with lower incomes, and women were bearing the brunt of the COVID-19 pandemic. And this finding, I'm just going to walk through some brief snapshots and findings from our report, but these are not exhaustive, and I'd encourage you to explore the report if you have further questions or want to explore all of the data analysis. And again, I'd encourage our participants to ask any questions that you have so we can answer them at the very end of this webinar. But looking at the disaggregated data and the effects of COVID-19, we had asked individuals with debt if they had applied for debt relief during the COVID-19 pandemic. And among those who applied for some type of debt relief, Black individuals were least likely to have received relief. So only 61% of Black applicants had received relief, compared to higher rates for Latinx and white individuals. And this is significant considering that we know that Black individuals reported having unmanageable debt loads at even higher levels than other borrowers, yet were less likely to have received relief. Likewise, looking at savings balances over the course of the pandemic, and by savings, I mean the balances in people's liquid accounts, including accounts like checking, savings, prepaid cards. Looking at our transactional data from the end of February to the end of July, we saw that balances had increased more in terms of dollar amounts for people with higher incomes. So individuals with a household income of $100,000 or more saw their balances increase by $5,600 over the past, averaged over a past month, while individuals with lower incomes saw increases in savings balances by much smaller amounts. So those with income between $60,000 and just less than $100,000 saw balances increase by about $1,500. Individuals with with household income between $30,000 and $59,000 saw balances increase by about $900. And individuals with household income less than $30,000 saw their balances increase by $700. So again, we have evidence that the COVID-19 policies and stimulus payments boosted people's balances, but they boosted, but individuals with higher income increased their balances by even more than those with less income. And again, we think this is due to stimulus receipt, but also by the ability of individuals to reduce expenses. There's other research that was conducted during the COVID-19 pandemic that points to individuals with higher incomes being able to reduce their expenses more easily and more dramatically, while individuals with lower income who might already be have very similar income and expenses have a much reduced ability to reduce their expenses and aren't able to accumulate savings nearly as quickly as those with higher income. When we look at gender, we find that women are more likely to worry about paying their bills in the future. So we asked respondents if they're worried that their household would struggle to pay rent, mortgage, or utility bills in the future. And we see that women are 8 percentage points more likely than men to say that they're worried about this. Whereas when we ask people about being able to struggle to afford basic necessities like food and healthcare in the future, we see nearly a quarter of women are worried about their household's ability here, while men are much less likely. Our final finding looks beyond the COVID-19 pandemic at financial health generally. And we see that in part due to the COVID-19 pandemic, financial health disparities have widened by race and income and persisted across gender. So looking at race and ethnicity first, when we look at the changes in financial health between 2019 and 2020, we see that individuals who are white had an average increase in financial health of, excuse me, the percentage of individuals who are financially healthy increased by 5% from 2019, while the percentage of individuals who are Latinx that are financially healthy increased by 4%. And we didn't see any statistically significant change in financial health for individuals who are Asian American or Black. Now, for the Asian American sample, this is due in part to our lower sample size for this in our data set. But we see that Black individuals had a slight decrease in financial health. Again, it's not significant, but this demonstrates how the financial health gap is widening. Black individuals already were less likely to be financially healthy in our data set and saw no change, where white individuals were more likely to be financially healthy in 2019, saw increases in the proportion of them who are financially healthy. And again, some of these trends existed prior to COVID-19, but we believe they've been exacerbated by the COVID-19 pandemic and other existing trends. Likewise, when we look at financial health by income, we see that those who with a household income of over $100,000 saw a very large increase in the proportion who were financially healthy, an increase in 9 percentage points. Those with income between 60 and 99,000 saw a significant increase, as well as those with income between $30 and $59,000. Those with the lowest income of less than $30,000 did not see a significant change in financial health. Again, from other research, we also know that lower income individuals were also extremely impacted by the COVID-19 pandemic, which might explain this. This lack of a change in financial health, while higher income categories saw an improvement. But again, these trends existed prior to the COVID-19 pandemic and are continuing to grow throughout 2020 and in light of the COVID-19 pandemic. Finally, looking at the financial health of men and women in the survey data, we saw that women experienced a greater increase in financial health than men, an increase of 6 percentage points, while men saw a 2 percentage change that was not statistically significant. So that's a positive trend in a sense that women appear to be gaining out of financial health in terms of the proportion who are financially healthy. But it's important to consider that that women are still trailing men. Men are still more likely to be financially healthy than women, despite these gains in the past year. And on that note, that points to kind of where we go from here, which we covered in our Pulse report. And given these changes in financial health over the past year and the disparate impact of the COVID-19 pandemic, this demonstrates the need for substantive financial health solutions, especially in light of those past few slides that I just showed you. So in the short term, we think that measures that provide people with immediate relief, including additional stimulus payments, extended unemployment benefits, ongoing eviction moratoriums, and continued loan forbearance and debt relief measures are really important to help people cope with the ongoing pandemic, which we're still very much in the middle of. And in the longer term, and taking a broader view, we think that solutions that address the systemic barriers to financial health, such as policies that ensure pay equity, living wages, workplace protections, affordable health care, and access to high quality financial products and services, are necessary to ensure equitable financial health outcomes for all. I think that's a really big topic to end on, but I encourage you to explore our report a little for more detail on our findings and on our proposed solutions. But now we have some time for audience questions. So Thea, I think I will turn it back to you.
Perfect. And I'll take this opportunity again to remind folks they can submit questions to us about anything that I or Andrew has covered to date or anything we haven't covered. And I'll start with a couple of questions that we received directly, which is about our plans to continue measuring and monitoring financial health throughout the ongoing pandemic. Do we have plans at the Financial Health Network to do so? I'll tackle that one, and then I'll kick it over to Andrew to add a little bit more color on some of the data that we have seen actually since July from a transactional data standpoint. But the short answer is that indeed we do have plans to continue monitoring how financial health changes amidst the ongoing COVID-19 pandemic, continuing to use this combination of the transactional data and survey data. So the nice thing about the transactional data is we've now built this data asset, this steady flow of data from those 800 individuals who are sharing their data with us on an ongoing basis. It's not exactly real time, but it's pretty close to real time. And so we plan to continue to mine that data set for really, telling granular, nuanced insights about how people's savings balances are changing over time, their spending, their debt loads. We can see how fines and fees and interaction with the financial system is changing over time. We also plan to go back into the field and to collect ongoing survey data. So we have plans to resurvey the very same pulse survey respondents at the end of this year to get a sense of what has happened in these people's financial lives since that end of summer timeframe where we fielded the last survey. And if I were to hypothesize, I would guess that indeed that financial health high water mark was a high water mark, and that folks that financial health may be much lower towards the end of this year without the absence, or with the absence, I should say, without additional stimulus measures or relief measures. And so we'll be sharing that new survey data come the beginning of next year. We'll also be gearing up for our 2021 annual pulse survey. And so indeed, we do plan to continue to collect, share, analyze ongoing insights about financial health on an ongoing basis amidst the quickly evolving COVID-19 pandemic. Andrew, I wonder then if you want to take this opportunity to share a little bit about what we've seen since July. So you shared the up to July metrics, which was what we covered in the 2020 trends report, but we do have data really up and through September and October. Can you share a little bit about what you're seeing for some of these key transactional metrics, looking at that fresher data?
Yeah, totally. And as you mentioned, Thea, the transactional data allows us to view a lot of these trends in real time in ways that survey data just doesn't allow us to do. There's a lot of time and effort, and we have to kind of spend takes survey respondents time to submit to answer a survey, while the transactional data, once it's set up by respondents, gives us a live feed into their financial lives. So while we explored trends through the end of August in the report, we have been able to track that on an ongoing basis. And we see that a lot of these same trends have continued. Credit card spending, for example, has not returned to the levels that it was in March and April. We see that spending balances have gone down since the end of July a little bit. And it's even more relevant during the holidays, which are rapidly approaching, which we know that is sometimes a really tight financial time for individuals. And so we're going to be monitoring spending and savings and income during the holidays during the pandemic. And then finally, I think it's, we kind of have our eye towards tax time in 2021. As you saw in the graph earlier in the presentation, tax returns really presented a boost in income, and there's a lot of other research showing that tax returns provide a real benefit in terms of income to a lot of individuals, and that'll be really interesting to monitor in light of the pandemic, and potentially in light of potential stimulus payments in the future. So there's a lot for us to keep our eye on, a lot of research that we'll be releasing as we continue to monitor these data sources.
That's great. And Andrew, I think many of our attendees may be financial service providers, banks, credit unions, fintech startups, and others. And we spoke a little bit about how folks have interacted with financial service providers over the last couple of months. We explored some of the disparities in access to the loan forgiveness and forbearance. But we also have data on how, at least at the national level, people have experienced overdraft as well as fines and fees. We did not cover that in this presentation nor in the report, but I'm wondering if for those financial service provider attendees of ours, you can share a little bit about what we saw about experiences with the financial services system over the summer.
Yeah, so we are able to, let's see, I showed in an earlier slide, we're able to look at spending categories. And so we're actually able to look at categorize expenses due to late fees and due to overdraft. And we cover some of that in the report, so check that out if you're interested in a little deeper analysis. But at a high level, we saw declines in both late fees, in the instance of late fees and instance of overdrafts. And we hypothesize that it's due to two things. One, reduced spending during the COVID-19 pandemic, especially in March, April, May, during the lockdown, when people weren't able to get outside of their house and spend money as they might normally do in a non-pandemic time. So due to reduced spending, there was a reduced instance of overdraft and late fees. But we also know that a lot of institutions either provided some sort of relief for overdraft fees, and we're not charging the same amount that they might normally do during overdraft, or really providing assistance to their customers to help weather fees and other types of larger financial volatility that's happening during the pandemic. So we saw those, the instances of late fees and overdraft fees reduce, but I think there's a lot of reason to continue to monitor that as we get further and further from stimulus payments, from the expanded unemployment benefits, and as kind of employment stays at higher than average levels, that we're going to really continue monitoring these instances of fees as indications of reductions in financial health potentially.
Great. One other audience question I see here is about our financial health scoring methodology for transactional data. And I'm happy to take this one, and Andrew, let you chime in afterward. But the question is about whether we intend to build some sort of a financial health score like we've done on the survey data based on transactional data. And indeed we do. This is work that we have slated for sometime next year, this coming year, 2021, in order to allow ourselves as researchers, but frankly, most importantly, those financial institutions who have access to their own customers' data to be able to do some sort of a scoring methodology, again, analogous to the FinHealth score, but based on inflows, outflows, balances across a multitude of projects. So that's going to be run actually from a separate team, through a separate team here at the Financial Health Network, but it is indeed work that we intend to tackle and that a methodology that we intend to make public in one way or another within the next year or two. So I would encourage our listeners to stay tuned for that. So I don't see, please, Andrew.
I'll just add real quick, Thea, that we have a lot of reason to believe that a transactional scoring methodology will be pretty comparable to our survey scoring methodology. So when we construct transactional metrics, similar to those 8 indicators at the beginning of the presentation, there's a lot of directional alignment. So for example, when we compare, we ask people on the survey how many months of savings they have in emergency savings, essentially. And when we compare those survey responses to a transactional metric in our transactional data set, we see very clear and distinct and consistent alignment between survey responses and transactional data. Likewise, we asked people about, on the survey, about how manageable they consider their debt to be. And when we compare that response to the amount of interest that people are charged on their credit cards, i.e. being indicative of a revolving balance on a credit card, we see really clear alignment. People who say that they have no debt have virtually no credit card interest payments. People who say that their debt is manageable have very low credit card interest payments, while people who say that their debt is not manageable have relatively higher credit card interest payments. So I think that's going to be a really promising avenue, and something that'll really help financial institutions measure financial health in a much faster and kind of more direct way than using a FinHealth score survey.
Great. There's a lot more to explore there, certainly with the alignment of the survey and transactional data. So we did just receive a couple more audience questions. I'll read the first one out. Happy to tackle that and then open it up to you, Andrew. Understanding that every consumer's financial position and situation is different, are there any general recommendations that we can offer, especially for those who are financially vulnerable and coping? And I think normally, we would have a certain set of recommendations, certainly acknowledging every individual's unique position, understanding how they're spending, saving, and borrowing and planning. But those recommendations may align more with budgeting, making sure that you're using the right types of products for your needs. This year, the situation is completely different, right? And so some of the advice that I personally would offer for those who are working with financially coping and financially vulnerable consumers has a lot to do with ensuring that they are applying for and receiving the various relief measures that may be available to them. So if they were unfortunate enough to lose their job, making sure that some states require all states, I should say, require the application of those additional funds in unemployment insurance. There are different rules that pertain to the forbearance and the forgiveness. It's offered automatically in some cases, student loans issued from the federal government. In other cases, it requires a direct application, but making sure that consumers are aware of their options for deferring payments, that they're in touch with their lenders if they're struggling to make those payments. The same type of advice goes for those struggling to pay their rent or their mortgage, being in touch with their landlords, applying for any relief that may be available to them, as well as the stimulus payments, right? There was a large swath of the country that has not actually received their stimulus payments, maybe because they didn't file their taxes in the previous year. And so there's some relief that's being left on the table. Of course, we are at somewhat of an in-between moment where we are waiting for what will hopefully be a new round of stimulus measures, a new round of the CARES Act to be approved, ideally early next year. But there are still really ways that folks can take advantage of some of these relief efforts. And of course, that you all, for those of you in capacities that interact with consumers, can help them navigate what can often be a very complex system. Andrew, anything you'd add to some advice for folks based on our data and findings?
Yeah, I think the only thing I'd add is that we saw in survey responses that people were taking advantage of debt relief or mortgage forbearance or kind of some sort of like rent delay, things like that. That was pretty common. I think, and we see that at the federal level, with mortgages and federal housing and things like that. But I think the one thing that we should be keeping in mind is that this is not rent cancellation. This is relief in the moment, but like at some point those amounts are going to be due, and that's has been pushed out, but that will have a really big financial impact on people when they have to return to paying a mortgage, a rent, a student loan, well, their job may not have returned. And I think as financial institutions, we'd kind of want to be prepared for that and think about ways to help people weather that return to debt payments, when the relief expires.
Absolutely. Another audience question about the impact of the pandemic on un- and underbanked folks, and the questioner asks whether some of these effects are being offset by the rise in digital neobank type offerings. It's a great question. It's one that we didn't look a ton into in our survey, though I think Andrew has a couple insights he can share. But I'll tease some research from one of our partners from Plaid that actually did look into this specific question. Plaid wanted to see if people's engagements with fintech offerings, neobanks, budgeting apps, things of that nature really helped offset some of the impact of COVID-19, but more generally, just really these fintech solutions help people better manage their financial lives over the past year. And they found that a significant portion of their survey respondents, it was a nationally representative survey, indeed reported that being able to access fintech solutions has always been important to them, but never more so than now, when we know that bank branches, in-person channels were closed for many months and frankly may be closed again. Having the ability to manage your money via a mobile app, via an online interface has really been incredibly valuable. And so I would encourage you all to, I'll give a shameless plug for our partners' research, but it really is high quality research. Again, it's from Plaid. Would encourage you all to check that out. Andrew, what would you add to that based on our data set?
A couple things, namely that we know that those who were unbanked were received stimulus payments a lot later.
Mm-hmm.
And that has a negative implication for people's financial health. So if we think back to the time when stimulus payments were being released, they were being sent first to people who had received tax returns via direct deposit. So by definition, those individuals would be banked and would be savvy enough to have received their payments by direct deposit. But by definition, unbanked individuals would not have that capability. So there was a several month lag before individuals who did not have it set up, who are disproportionately more likely to be unbanked, receive stimulus payments. And that was time where I'm fairly confident in saying that they could have used the money to weather the COVID-19 pandemic. So that, again, has negative implications for people who are unbanked or people who are low income that would really be hit the hardest by the COVID-19 pandemic. And again, given all the talk around a second stimulus payment, that is an issue that we're going to revisit, potentially soon, in ensuring that federal stimulus payments get to the people who need it the most, those who are lower income and or unbanked, receive their stimulus payments in a timely fashion. I think there's a lot for financial institutions to think about and how they can help individuals weather the time between when stimulus payments are first released to when unbanked individuals actually receive them.
Indeed. Well said. So with that, I don't see any more audience questions. So I did want to leave you all with just a few ways in which you can engage further with the data set, with the Pulse data set. So everything that Andrew and I just covered over the last hour is really scratching the surface of the wealth of data, the wealth of findings and insights that are in the full 2020 trends report, as well as the many insights that are in the Pulse data set that are available for us and for all of you to engage with further. But as a first step, if you're looking to engage further, I would encourage you to download the 2020 trends report. It's lengthy, but there's a lot of really compelling insights in there. Additionally, I would encourage all of you to explore the publicly available Pulse data set. So we have made all of the survey data from this year, as well as the past 2 years, publicly available on our website, finhealthnetwork.org/pulse, If you are interested in exploring the data, it is there. It is available for you or for your analytical teams to explore further. Additionally, you can request customized data cuts from us. So this is an option that we primarily make available to members of the Financial Health Network, but I figured I'd highlight it here because it's worth reaching out to us and discussing how we might help you answer a specific question, understand an issue, understand financial health trends amongst a specific demographic. So please don't hesitate to reach out if you have any questions about that. I'll share our email addresses in just a moment. There will also be an option on a follow-up survey that you can click if you would like us to reach out to you directly. Last but not least, you can host a presentation or a workshop diving into a specific topic or issue at your organization, of course, virtually at this point in more depth, or if you think that your colleagues may benefit from a similar type of broad overview that Andrew and I just gave, you can reach out to us and let us know, and we can discuss what it might take to be able to host some sort of a virtual presentation or workshop at your company or organization. I also want to encourage you, if you were intrigued by this financial health measurement framework, if you think that your business, your organization could benefit from using this methodology to assess your customers and employees' financial health, would encourage you to do so. So the basic FinHealth score methodology that I highlighted at the beginning of this presentation is completely free, open source, available for you all to use. But we've also built a product, a new tool actually, that we are also offering to interested stakeholders that's essentially a survey deployment platform that allows us to help you collect the survey responses directly from your customers and your employees, to benchmark that data against these national or regional benchmarks supplied from the US Financial Health Pulse, and to make sense of what these findings mean for your company. So if you're interested in learning more about that product, I would encourage you to go to the link on this screen, finhealthcheck.com. We are beta testing that product now, but would love to talk to you to see if it might be the right fit for your company or for your organization. And last but not least, I wanted to highlight a couple of upcoming webinars that the Financial Health Network is hosting. There will be one that I'll be co-hosting with a few of my colleagues that explores some recent research that's affiliated with the US Financial Health Pulse that explores financial health trends of young people, exploring disparities and differences by race and ethnicity, highlights some interesting research from a new report that we just published, along with our colleagues at Gen Forward of the U of Chicago. We also have another webinar. This one is hosted by Fifth Third Bank, a member of the Financial Health Network, focused on closing the wealth gap and the financial health gap, looking across key demographics as well. You can learn more about each of these webinars at the website on this screen. And finally, I'll leave you with the contact information for myself and for Andrew. Please don't hesitate to reach out to us to explore additional ways that your company or yourself or your employees or customers can make the most of this data. Thank you all so much for joining us today. I hope you have a wonderful rest of your afternoon. Thanks so much. Bye-bye.